Was just elected the new president of the New York State Association of Counties. Now, that group is on board with Governor-elect Andrew Cuomo's push for property tax relief through a cap, but also says that true reform cannot be achieved until the state relieves the counties of their unfunded mandates. Maggie Brooks is the Monroe County Executive. She is joining me tonight from Rochester. County Executive, thanks for your time.
Thank you very much.
And congratulations.
Thank you. And actually, it's a president of the County Executives Association, which is a subset of NYSEC, but thank you.
Pardon me.
You gave me a promotion.
Yeah, well, you never know what might be in store.
That's right. There you go.
So I wanted to talk to you about this. This is the report right here. You guys have nicknamed it actually 9 for 90. It is 9 mandates that you would like to see the state relieve the counties of. And do you just want to quickly go through some of the highlights?
Sure. You know, we believe that there are 9 programs that are run in New York State, and they consume 90% of the property tax levy in almost every county across the state. Outside of New York City, $4.4 billion is collected every year in county property taxes. These 9 programs consume $4 billion of that amount. So as you can see, if you can get to these programs and if you can reduce the impact of these programs on taxpayers, you can certainly stop talking about capping property taxes above the national average. You can start talking about actually reducing property taxes. And what are those 9 programs? Well, we've talked for a long time as county executives about Medicaid. That is clearly the largest of the mandated programs and the one that we've struggled with historically.
Right.
But there are also mandates. Pension costs are a mandated program consuming a lot of our taxpayer funds. Youth detention, child welfare, early intervention, probation. Those are some of the programs that are consuming the majority of tax dollars in New York State. It's not sustainable.
Okay, so let's just start with Medicaid. This is pretty much the biggest chunk, actually. You're talking about pretty much the lion's share, and the lion's share of what the state spends actually in its budget. So what the counties would like to see the state do is pick up the entire bill for Medicaid, the whole thing, which is something that Governor Pataki actually started to move to do, nibbling around the edges, but never really quite got there. So this issue, though, it seems to be a little bit of a political football. And also, where's the state going to get the money?
Well, as part of the new Federal Health Care Reform Act, it gives states and local governments, in our case in New York, because counties share in the cost of the Medicaid program, that national health care bill gives states flexibility around making changes in the Medicaid program. So for the first time, we really do have an opportunity to look at the program and restructure the delivery of the services and the way Medicaid is carried out in New York State. We have asked the state to take a look at taking over the administration of the program. We realize that the state has a fiscal crisis as well. So we're not just saying, look, take it over and you pay for it. What we're saying is, if you start to administer the program, if you start to make decisions about how the services are provided, there's built-in incentive to then look at a different way of delivering the service and actually reducing the cost of the program. Right now, the counties administer the program, and we get reimbursed for the administrative portion, so there's no incentive for the state to really look at doing anything differently. We believe if they take over the administration, they will then look at how to reduce costs within the program, and that's a positive step forward for everyone.
You know, what we're seeing actually now is dueling reports. We're actually getting also one coming out of NICOM, we're getting one coming out from the school boards, but it seems to me that everybody has the same issue, which is the property tax cap the governor-elect has proposed at 2% is something that you're very concerned is actually going to negatively impact local governments and school districts, because that's really where they get most of their money. So if you say to people, you can no longer, to yourself, for example, as a local elected official, you can no longer raise revenue this way, then you guys maybe, are you worried you're going to go broke?
Well, we absolutely could. We can't sustain the level of spending that we are asked to spend as counties. Counties are in a very unique position to be able to partner with the state to reform some of these costly programs because we are the service provider. Counties deliver the human and health services for the state of New York. We're an arm of state government, so we are uniquely positioned to help the state look at these programs and make changes in these programs. Mandates, you can cap property taxes, but let's face it, our property taxes are 80% above the national average right now. So even with a cap, you're capping them at a high level, and our taxpayers deserve better than that. They need us to take a look at what is driving up the cost of living in New York State. These 9 programs are at the top of the list. If we can start there, then I think ultimately we can look at reducing property taxes in New York State, and I think that's the goal. That should be the goal.
Now, I know a lot of elected officials have actually cut a lot to the bone, is in some cases. However, you're seeing NICOM, the mayors today, coming out and saying they would like to see a public employee freeze, not just what Cuomo has proposed at the state level, but also at the local level. How do you feel about that?
Well, I think we have to look at everything on the table. Obviously, counties control very little of their budget. For example, in Monroe County, 80% of my budget is mandated by the state and federal governments. To the extent that pension costs are part of those mandates, we really need to take a look at that. I only control 18% of my budget, and that's what I worry about because I'm making decisions within that small portion about making sure the roads and bridges are fixed, making sure the parks are open, all the quality of life things that people come to expect are in that small portion. As the mandates grow and grow and grow, and we are told to do more with less by the state of New York, those areas that everybody has come to expect as part of their government services are being impacted in a very negative way. So I think everything is on the table going forward.
Okay, even freezing pay for local employees at the county level.
Well, I think we have done a good job, and I think counties all across this state have done a good job of imposing our own type of a freeze on employee benefits. In other words, in Monroe County, we did not offer any increases unless we could offset those increases with health care concessions. It had to be cost neutral to the counties. So you know what? Already the counties have been making those difficult decisions and resolving these issues in creative ways by working with their collective bargaining units. I think the state needs to look at some of those tough choices before implementing just a blanket freeze. I'm not sure that that is the answer. I think we really need to look at how we're spending our dollars and maybe readjust our priorities, restructure some of these cost drivers that the county executives are talking about, and then see where we are.
There's also been discussion when it comes to the pension system. I mean, the Empire Center calls it a ticking time bomb. You've at least one of your colleagues from Westchester, Rob Astorino, has suggested that he'd like the ability to negotiate himself collective bargaining with his own local unions on pension givebacks. That would require changing the Taylor law. Are you on board with that?
Well, I think anytime you can give a county executive or a local administrator more flexibility over how they spend their dollars, that's a good thing. One of the things that concerns me about the pay freeze is that, you know, we complain about mandates from the state of New York, and then on the other hand, with a pay freeze, we say, okay, tell us what we can do here in terms of our public employee salaries. It's almost, it almost seems hypocritical to be doing that. I think if you can give counties more flexibility over how we spend our dollars, how we can customize our budgets so that they meet the needs of our populations, so that we can provide and implement these programs according to the need in our own communities, I think you're going to see localities saving money and ultimately being able to save money for the state of New York, our partner in some of these social service programs.
And what about the issue of consolidation? Some people would suggest actually it would be better if local governments worked together to cut down their costs by saying sharing the cost of, I don't know, snow plowing, which seems to be a big issue out in your way these days.
Yeah. Well, we do that already. Monroe County has more shared services agreements than any other county in the state. We already have done a lot of the things that other counties are talking about. The low-hanging fruit in most counties is gone. I think you will hear more and more conversation about how do we combine services, how do we share our computer systems, how do we share fleet maintenance services. You know, those are the things that counties, how do we share our public safety services. I think you're going to hear more and more conversation about those going forward. I think where you get the difference of opinion is how do you define consolidation? Some people say that means eliminating government boundaries. My definition is shared services, because you can eliminate every government boundary in New York State. You still have a certain population that needs services. The cost is in providing those services.
The governor-elect has actually proposed putting a sunset on mandates of the type that we were talking about at the beginning of the interview. A, do you think that there's a political will to do something like that, because it forces state lawmakers to get on the record every 2 years, and the opportunity for people like yourself to lobby them not to put mandates back on the local governments?
Well, I think, you know, sunsets are a good soundbite, and certainly to your point, there's some short-term gain there. But I think there's a way that we can all work together to figure out what makes sense and what doesn't make sense. Let's go back to Medicaid. You cannot continue to support at the local or the state level a Medicaid program that is larger than the states of Texas and Florida combined. It's just not sustainable. You know, we're a state that has offered the entire menu of Medicaid programs to our residents, and then some. We've actually added some programs and medicated populations that aren't actually part of that program in any other state. So I think there needs to be some conversation. It's nice to say, okay, no mandates going forward, and anything that is a disincentive to mandate programs in the future, you know, how am I not going to support that? But I think there needs to be some reasonable conversation to start with these 9 programs. There's no easy answer, there's no silver bullet, but we've offered the state a starting point. These are 9 programs that consume 90% of the county tax levy statewide. That's a great place to start.
Well, we are seeing a lot of competing interests and voices coming out, and we have not yet even seen Governor Cuomo take office, so it's going to be an interesting year. I want to thank you very much, yeah. County Executive Maggie Brooks, for joining us. Thanks, County Exec.